We're going to talk about automation. Why, you ask? Because 91% of healthcare leaders report a favorable ROI with automation. In fact, 52% experience up to three times the ROI. So, in this presentation, I'll show you how you can leverage automation to take your facility from good to great and reduce your risks and increase your efficiencies. Welcome and thank you for joining me. My name is Reza Ghafoorian. I'm co founder and CEO of Perla. So, today we're going to talk about how to optimize versus how to automate and some strategies surrounding each one of these steps to make your corporation or your company or your practice more efficient. And at the end, we'll just talk about some questions, pertinent questions that you want to ask to understand the technology that you're purchasing for automation. So let's now begin to discuss the path to automation, and it begins with with optimization. Without optimization, you can really not achieve automation. And in fact, Bill Gates says it the best. He said that automation applied to a chaotic situation will give you more chaos. Whereas if you take the time to first optimize and then go from optimized processes to automation, you will have a meaningful result and a more favorable, successful result with that process. So, what is optimization? Optimization is the process of analyzing your existing workflows or processes within your business and then making them more efficient and more effective, but without really incorporating any technology to do the work, to do the steps for you. Automation, on the other hand, is when you actually have technology uh, uh, do the work for you and automate the process for you. The benefits of automation is pretty much the same as optimization, but you just get more of that. You get more efficiency, you get more uh, you save more time, reduce human errors even more, and you become more effective. All right, so going from chaos to clarity really requires the proper steps to give you the best results at the end. And the steps are usually you go from a manual process and you look at your manual process to optimize it. And then when you have an optimized process, you look at that process again to automate it. And in order for you to go to optimization, we're going to take you through five steps. You got to map your workflows, understand what those processes are, define your ideal state, take away the steps that are useless and redundant, reallocate your resources, and then continuously improve your processes and adapt it. We'll go through each step very quickly to kind of give you an understanding of how to organize your mind in terms of going from manual workflows to optimized workflows. So, how do you identify a workflow or a process that you want to optimize, right? You want to look at underperformed processes. Then you want to do a flow chart of that process step by step. Then you want to look at that process, the step by step process, and identify bottlenecks and slowdowns in that process. Then you improve it, and then you continuously improve it as you work through the process. So, what are underperformed processes? There are those that are constantly failing to meet the goals that your team expects to have. And then the slowdowns are those bottlenecks in processes where things become very slow and really don't go through as efficiently as possible. Okay, so you identify an underperformed process to optimize. Then it is a good idea to really then define your ideal state of that process. What you want to ask yourself the question: what should this process look like if it was run efficiently every time? Right? Then you want to have an idea of that. For example, in a credentialing process, let's say you want to do perform a staff credentialing in less than of a new hire in less than 48 hours or less than 24 hours. Okay, so then that would be the ideal state that you want to achieve. Once you're there, you say, you look at the process and the steps, and you ask yourself, which one of these steps I have to eliminate to really achieve what I want to achieve, 24 hours of say credentialing. So you delete redundancies and you delete unnecessary steps. In addition, you look at your resources, the amount of money you put into it, the tools that you have for it, and the allocation of staff, and you rearrange it and see where you're spending too much energy, where you're not spending too much energy. You reallocate resources to make the process have more equilibrium throughout. And at the end, you want to constantly be assessing yourself with metrics and feedbacks and training and reviews on a quarterly basis or weekly basis or monthly basis. So you always want to have your hands on the pulse, making sure that the process is working properly in the optimized process. Okay, so that's pretty much going from a manual process through optimization, 5 steps to get it optimized. Similar steps we take to go from optimization and organizing ourselves in going from optimization to automation. This process is important because you're going to be spending additional funds and resources in identifying technology that can be implemented. So you have to pay attention and really plan this properly. The process is similar. It has 6 steps instead of 5 steps that we put together, but very similar to optimization. Again, you want to identify exactly what processes are there that you can or you want to automate, because optimization is just not responding as well as you want to. So you want to automate to make it better. Then you want to evaluate and prioritize uh, those workflows and the processes. Which one is the most high value and the least efficient? And you say, and then you can say automation can save me or in liability or in costs, for the number one more than number two and number three. So you prioritize that aspect of of the planning. Then you have to create a plan. You want to know, you prioritize items on your list which provide the biggest value again. And then, you want to have an implementation plan that would fit within your day-to-day processes. And it doesn't really interrupt your daily routines and your staff too much when you want to go through planning and implementing an automation process. The next step is to really identify in the market what's out there, what are your tools, what can you implement, what are the automation technologies that you can bring into the system, and what are you really looking for in those technologies to help you with your processes. You implement it. Implementation is not easy. It requires planning. It requires culture change. You will always be tempted to go backwards and revert back to your optimized system, which is not as efficient. You have to be disciplined in working through the problems of automation so that you can become successful. And once, if the proper culture is implemented, you will get to the time that everybody is using the system properly, and you reap the benefits of that. Regardless of how easy it is to automate or the process, do you want to set it and forget it? Regardless of all of that, you really want to make sure that you go back and constantly review the process, get feedback from your staff, and make sure that the system is giving you what you really asked for. You go back to your ideal state, making sure that if what what you have implemented really is giving you your ideal state results. All right, so an example, we picked an example of automation, which is simple to understand. it's a process of credentials management. Let's say a nurse who has a license in the system in the facility, every 2 years they have to renew it. Expires and they have to renew that license, and you have to receive a copy of that license, renewed license, so that you can make sure that everybody on your staff, the nurses, are properly authorized to provide healthcare. 29 steps we counted it takes to go from receiving the license, maintaining it for 2 years, and then receiving a new one with a many tasks, including sending out reminder emails and several of them, and then receiving the new email. Okay, so this task um, was initially at some point manual. This is the optimized version of it. I'm sure it can be optimized a little bit more, maybe a couple more steps, but this is what it looks like in a lot of our nursing homes that we've encountered. And then you can really look to see how automation will affect this process. You can really see that automation can take you from 29 steps to really one step. So if you're spending all of this time, this is a very low efficiency process, and it's a high value because you have liabilities for not having a license. You really can eliminate a lot of the steps going from 29 to one. So really, automation in this case, if you pick this workflow, will really set you free. In reality, you go from 29 to one, and you're using four softwares to one software, and that is eliminating 97% of the redundant tasks, and then 80% of the software that's required to run the optimized system. So this is how you kind of decide, as an example of a workflow that you can implement automation. It's a pretty optimized process that can get much more greater results if you automate it. Okay, so we also wanted to show you how to prioritize and plan for going through from optimization to automation. So we gave you some examples. We use the same 29 steps. You can always optimize the entire process, or you can look at some aspects of the process and say, hey, you know what? I'm sending 3 reminder emails. Let's just automate the reminder email aspect of it. It's still a very time consuming process, and it's high value because if we don't send those reminders, say, our nurses will not provide us the new licenses, and we're going to miss that. So this is how you plan it out. You first evaluate it, then you research your tech, and then you create your plan. And I've given you examples in here to kind of walk you through the process, the mental process required to go from identifying the workflow to really planning it out. So how do we evaluate it? So we say reminder emails are time consuming. So if we're managing 100 licenses of nurses, then we're spending a lot of time sending these reminder emails. Say 4% of one of our staff time is wasted annually to manage this process. That's close to $1,300, right? But in addition, you also have some liabilities, because if you're miss the license, and your nurse is practicing without a license, you can get audited, and you can get penalized. Also, maybe if you're practicing without a license, your nurse is provisioning health, and the license is expired, maybe your malpractice will not cover a lawsuit because the your nurse didn't have a license. So anyway, so this becomes a very low efficiency and high value process for you to take a look at, and then try to automate. So if you pick this, then you want to research, what tools do I need? What do I want from the tool that I want to implement? What are the characteristics of the software that I want to search for, right? Before you search for it, you want to say it has to automate my emails. It has to be mobile compatible. I have to be able to interact with my information and the database. I have to be able to allocate tasks within that software, that I want that feature within that software. I also want it to be HIPAA compliant. I also want it to be easy to use and easy for training. and then you go search for the proper tool that has all of these criteria. This makes it much easier to find the tools that you really need rather than getting something that you won't actually work with your system. Then you have to plan in order to be successful in implementing and going through this process is very painful, painstaking process of getting to this point. If you don't plan it, you don't have set goals for completion, it may never happen. So let's say for this software, you decide that you want to do this, then you set a plan of 6 months. Say by November 30th, I want everybody to be using this software, and all the emails are going to be automatically sent for license renewal. So I want to purchase a solution by July 30th. I want to assign Jackie, the administrator, to make sure that she learns everything and gets trained on this software by August 15. By October 15, I want Jackie to have uploaded all the licenses, done all the onboarding processes related to this software. Then I want to train my staff before October 25. And by November 15, I want everybody to be using the system. And then it gives you some time that to deal with other issues that may come up. By November 30, you're done, and the system has been implemented. All right, so that's pretty much how you go from a manual process to optimized process, and then from optimized process to automated process. And then at the end, I'd like to leave you with a couple of slides about tips on how to evaluate your technology, and then really critical consideration and questions to ask for about a technology that you want to bring on board. So always involve your team. It's very, very important that your team, the people who are going to be using that, are involved in those processes and workflows, are involved in picking the software or giving their feedback on the software. Consider software integration with other systems that you may have. In healthcare, there's many different software that may be in your environment. So you want to make sure that if it requires integration, then it integrates with the correct software that you own, and you're using. Make sure that they have cloud access and remote access, so it's easier for your staff to be able to interact with the software. If there's a free trial, take advantage of it. And if you have if there's training, you got to make sure that you understand how much training they're going to give you, or the professional services that they're going to provide to you. And then also, if there are testimonials, take a look at the testimonials. Finally, you want to ask a few questions on the technology that you want to bring on board. Does it enhance your security? Okay. Does it remedy multiple pain points? So you don't want to buy a software that just does one thing. You want to buy a software that does few things, that relieves you from a few aspects of a workflow. Is it scalable? A lot of software these days are no code, low code, meaning that they don't have the capacity to scale to larger numbers. Then you get stuck with that software that cannot scale. And then you want to look at your ROI, return on investment, for any investment that you put into technology, but you want to look at it in several different ways. You want to look at it in terms of hard cost, time savings, the liability, the reduced risk, and then convenience. So all of that goes into your return on investment. It's just not just the hard costs. All of it. The savings and the liability and the convenience are also very important in understanding your return on investment. Make sure that you give yourself a nice time and block of time to train and set up for a new technology. Make sure that you implement good culture, and make sure that you don't have you give up to the temptation of going back and reverting back into the old manual systems. And then always nominate someone within your team who's a point person for understanding that, being an expert in that software, that she gets all the training and she stays on top of all the changes and can bring back all the important aspects of any changes in that technology back to your team. Thank you for joining me. Again, my name is Reza Ghafoorian. I'm the CEO of Perla, and it was a pleasure speaking with you today.